I'm Mary Rabbitte. I'm the Research Programme Manager here at the All-Ireland Institute of Hospice and Palliative Care. And today I'd like to just give you a very brief update around the Palliative Care Research Network and the Early Career Researcher Forum. So, the Palliative Care Research Network, for those of you who don't know about it, the vision is to be the leading network for palliative care researchers on the island of Ireland, and that members undertake internationally recognised research that enhances palliative care knowledge and expertise and improves the quality of life and death of people with life-limiting conditions and their families. And we're delighted today to have members of the network, new members, and members who were there at the very start, and it's always change in the membership. So last year we launched the strategic plan, the 5-year plan up until 2027, and it's to strengthen and expand collaboration, to create that academical clinical environment to foster innovation, develop palliative care researchers and support career paths, involve people with life-limiting conditions, family carers and interested citizens and communities across the research cycle, and maximise research impact on practice and policy. So this year we welcomed 7 new members to the network. We now have 10 disciplines within the network, including medicine, nursing, occupational therapy, physiotherapy, pharmacy, psychology, law, health economics, social science and speech and hearing therapy. So as you can see, it's a vast team that deliver palliative care services. And we have new members from Dublin City University, Veronica Lambert, Maria Ryder from UCD, Fiona Timmins from UCD, Audrey Royalston from Queen's University Belfast, Eileen Furlong from UCD, and we've Sheriff Semple from Ulster University, who will be speaking later, so delighted to welcome Sheriff, and Esther Beck from Ulster University. So if you are somebody who's doing a senior researcher, leading researcher in the area of palliative care, please talk to us from one of our member organisations around PCRN membership. We also have our Early Career Researcher Forum, and this is for those that are in the early and mid-career stage of their research in palliative care research. They may be senior researchers in other areas. And we were delighted to have 28 new members, and 2 of those members that joined the PCRN have transitioned from the Early Career Researcher Forum. So one of our main achievements this year was the pilot special interest groups, and the aim of that is to bring together both the Palliative Care Research Network and Early Career Researcher Forum members across academic and clinical settings together to develop practice change in research, as Andrew said, and to improve the quality of life and death. We went through quite an extensive process and our chair at the time, Andrew Davies, with the Strategic Scientific Committee. So we went out and we asked people from the PCRN, the ECRF and Voices for Care members. We got 59 suggestions for groups. We then themed them into 12 areas. 7 were identified as priorities. We had a very collaborative voting system. 4 submitted detailed proposals, and we're delighted that today to launch the 3 pilot special research interest groups. So the first one is in the area of technology and palliative care, and these are, if you like, the founding members, but what we're doing today is calling out to people from the PCRN, ECRF and other people who are interested to join this group. They come from the South East Technological University, both Frances Cleary and Christina O'Loughlin, from the Royal College of Surgeons in Ireland, from University College Dublin. And one of the areas, as well as the Milford Care Centre, one of the areas they're interested in is virtual reality in palliative care settings. But that's just an example. So if you are interested in joining, we'll be sending that call out, please do. We also have a psychological, social and spiritual care special interest group, and we're delighted to have the chair of that, Barry Quinn, here, and Niall Galligan as well. So I'm sure they'll be delighted to talk to you today if you're interested in joining, as well as Nipuna and Breach are also here, and Helen Good. Again, they're from a wide range of areas, and they're interested in spirituality in palliative and end of care life, and assessing distress across the psychological and spiritual domains in palliative care. But they're just some examples of the areas they're looking at. And then finally, we have a group, Dementia in Palliative Care, and we're delighted as well. We have Siobhan Fox here today, who's one of the kind of founding members of it, who's the chair, and we've Una Malloy from St. Francis Hospice, Nicola Cornelli from UCC, and Irene Hartigan from University College Cork are also involved, and we'll be calling out for increased membership. And they're looking, one of the areas they're interested in is from the My Support EU 6-country study that was led by one of our members of the PCRN on the Comfort Care booklet to support decision making in people with dementia. So our priority in 2024 is to take a baseline of current hospice and palliative care providers, current involvement in research and their capacity to be involved in research. We think that's extremely important, especially with the implementation, hopefully, of the new adult palliative care policy and the research, the palliative care programme in Northern Ireland. We will also look at doing a prioritisation event with palliative care consultants, registrars, research nurses, and all relevant clinicians and PCRN, ECRF members and policymakers. So we're looking to do that in June of this year, so we will be talking to you about that. The other thing we just wanted to mention is we recently hosted the AIIHPC Public Health Research Seminar in Belfast, and we're delighted that so many of you could be there. We had a number of webinars during the year, and we did a workshop as well. So we had 272 participants, not just at AIIHPC, but of all of the events that we had on. And we also have all those recordings of those videos up on the Palliative Hub Professionals. So I'd say to you, if you missed out on the opportunity, do have a look at the PAL Hub. We're also really keen this year to start preparing for the HRB Collaborative Doctoral Award that's going to be announced in 2024 opening, and to look at the PCRN-led programme for that. And we've been very close on a number of occasions, very much so the last time, and that will be a priority for the PCRN. Involving people with life-limiting conditions, as Fergal mentioned, in the new adult palliative care policy in the clinical programme is so important to the work of the Institute. And we're delighted that one of the things we did this year is we had a PPI workshop in October where we were looking at how do you involve people with speech, language, communication difficulties and palliative care needs in research. And we're delighted that we had MK Clancy, who had motor neuron disease, who was involved, and also Michael Griffin. So both of them have speech and language communication difficulties. We sent out 30 opportunities to our members of Voices for Care to be involved in research from both our Palliative Care Research Network and Early Career Researcher Forum members. And what we'd say to you, some people know that we do that and we support, but for those that don't, please do contact us, and we'd be delighted to see if Voices for Care are interested in supporting you. And what I'd say is the panel are very good at coming back and trying to support if they can. So please do use the group. Maximising research impact on practice and policy is very important. It doesn't just start at involved in dissemination. It starts from the very beginning. We're very lucky to have a great team within the research team with very vast experience. And this really starts from the very start when you're looking at an idea, a clinical idea, or an idea that's come from the members of PPI, and thinking about how do you develop that proposal all the way through to the end, and thinking about how can you talk to policymakers and practitioners. And what we're saying is get them involved from the very start. So we can mentor and support you in that area. We had an implementation case study webinar there earlier this year. We have the Palliative Hub. I'd really say go on there and have a look. I know one of our Early Career Researcher Forum members who's completing a PhD thanked one of my colleagues this morning for a research study page on her PhD research and said it's great to have an area where they can promote their work along with their supervisors. We also are promoting publications, but that's not just the only area. Just some examples of our members' research. It goes across a lot of different areas. This is just a sample, it's not everything. So if you don't see your research here, it's just to give a brief overview. There's a lot in the area of decision making and how important it is. The future of service planning is another area. Symptom management as well. We also have a large number of studies happening in the children's palliative care area, and there is other studies around energy hardship and death literacy as well. So all of these things are extremely important. We have our members involved at an EU level. I know we have members here today involved in the DIADIC project, which is looking at psychoeducational interventions for people with advanced cancer. This is an EU study. We have the Better Be, which is breathlessness at end of life. We have our members involved in that. And the My Support study, which was key in the area of dementia and palliative care. We have a number of people from our PCRN involved. And I know there's going to be an announcement quite soon about another very following on from My Support study, which were very successful. So the Horizon Europe funding is coming. So finally, I'd just like to thank you, and I'd also like to introduce my colleagues, if you haven't met them. Emer Brangan, who's here, and Emer comes with a lot of experience in research impact, so if you haven't connected with us, please do. And my new colleague, as I said to Jane, she seems like she's been here for an age. She started in October, and Jane is the PCRN project manager. So thank you for your time. We're here to support you, so please do come to us. So.